Hi everybody, Dr. Daniel, and today I'm speaking about at what age do migraines stop? Well, the tendency to have migraine relates to inheritance of the migraine gene in one's family. Migraine is said to be genetic and familial in causation. Although the attacks usually start in the teens or early 20s, some persons do not start migraine headaches till later in life. So migraine generally stops for women at age 65 to 70 years old or after menopause. Migraine stops for men after age 50 to 60. A small percentage of persons, something like 2 to 5%, continue to have migraine past 80 years of age. An occasional patient will stop decades earlier than their 60s, sometimes not for clear reasons. All right, related questions. What's the usual age that migraine stops for women? To discuss this question, it's helpful to note that the International Classification of Headache Disorders, version 3, lists 4 different types of migraine, and these types of migraine stop at different times. There is migraine without aura, migraine with aura, menstrual-related migraine with or without aura, or pure menstrual migraine. This differential is important because migraine that comes with menstruation usually gets better after menopause, while non-estrogen-related migraine may not. It can be helpful to see the effect of estrogen on a woman's migraine pattern by asking if she had reduced migraines previously during her pregnancies. Migraine improvement during pregnancy may relate to decreased headaches after menopause. The patient has an estrogen-related migraine, so to speak. The average age of onset of migraine is 51 years old, but it can be in the 40s or the 50s. Menopause is defined as having 12 months with no menstrual cycle. If a woman with pure menstrual migraine or menstrually-related migraine had few migraines during previous pregnancies, she may well end her migraine experience at the time of her menopause. For these women, migraine may end at menopause. About 60% of women with migraine have either pure menstrual migraine or menstrually related migraine. The other 40% of women may have a note that their migraines end at age of 50 or 60 years old. What about perimenopause and migraine for women? Many women start the perimenopause phase of the menstrual cycle in their late 40s. Perimenopause means, quote, around the time of menopause, end of quote, and can last for 8 to 10 years. Estrogen and progesterone production becomes more irregular, with a decreased amounts of hormones being made along with irregular production. Women may have increase in the frequency and intensity of their migraine headaches during perimenopause, making this time in their lives accompanied by some of their worst migraines. Some women have the onset of their first attacks of migraine during perimenopause. Perimenopause can be a difficult time with irregular menstrual flow times, hot flashes, vaginal dryness, mood changes, and trouble sleeping. Along with these common physical changes, women may experience an increase in migraine intensity and frequency. There is a decrease in the amount of secreted estrogen during menopause due to the pituitary-induced decline in the neurotransmitter serotonin in the brain. There's also an increase in prostaglandin release during this time, and all these changes can really affect the 70% of women who have migraines with their menstrual cycle. Perimenopause may result in interrupted sleep, a known migraine aggravator. However, not every woman has worse migraines during perimenopause. Some may have an increase. Some find no change during that time in their migraine cycle. What's the effect of menopausal migraine? Only several studies have looked at this, and they've shown that the menopause makes migraine worse for up to 45% of women. 30 to 45% did not notice a difference, and 15% noticed an improvement during menopause. Migraine attacks for some continue to follow a cyclical pattern years after the menopause, and the reason for that is also really unclear. At what age does migraine stop for men? 40% of persons with migraine lose their attacks by age 65, and this affects men also, usually lose their migraine attacks starting in their 50s and 60s. Does migraine get worse in adults? Migraine attacks do often become more frequent and more intense with aging. Migraine often gets worse in adults. Headache diaries studied over decades show an increase in the number of migraine headache days as time goes by. This increase in migraine coincides with the transformation from episodic, which means 14 or less migraines per month, into chronic migraine, which means 15 or more migraines a month, 8 of which have migraine features, and is due to medication overuse syndrome. Increased migraines during adulthood may relate to risk factors of stress, anxiety, overweight, head injury, fibromyalgia, and depression. 50% of persons with migraine may also be depressed, and 40% have generalized anxiety disorder. Are there changes in the brain of persons with migraine as they age? Yes, migraine could cause an increased number of T2 microvascular lesions and slight brain infarctions or small strokes. These are referred to casually as spots or white dots, and specifically as WMAs, which means white matter abnormalities, or also they're called T2 microvascular lesions. There also may be larger lesions consistent with brain damage or infarction. The incidence of T2 lesions in migraine with aura is 8.1%, and migraine without aura 2.2%. So migraine with aura has a higher lesion load. Brain infarction occurs far more frequently than expected in migraine patients. Also, this is increased in migraine with aura female patients, 8% of which who may have subclinical cerebellar infarcts. And these lesions are usually clinically silent. It's thought that a causal relationship between migraine severity and lesion load exists, but no studies have shown these T2 lesions have relevant long-term functional correlates. As far as currently known, these T2 microvascular lesions are not associated with increased risk of stroke or cognitive loss and have no serious pathologic significance, although this position may change with further research and study of this issue. Use of preventive medication, Trypsin acute therapy, and living the migraine lifestyle are important components of the treatment of patients like this with microvascular disease. Well, what about the occurrence of acephalic migraine? Acephalic migraine is also known as migraine aura without headache, amigranous migraine, isolated visual migraine, and optical migraine. Sometimes it just occurs in men, but more frequently occurs in middle-aged women. It usually consists of a typical migraine with aura visual event, as seeing spots, holes, flashing lights, or zigzag lines, which usually last minutes, but which come without any headache. There also may rarely be nausea, numbness of the extremities, and sensitivity to light. On interview, many of these patients, who are usually women, aged 65 years old or so, deny any previous historical links to migraine. Yet they may have experienced migraine aliases, which are false names for migraine, such as menstrual headache, hungry headaches, nocturnal headaches, sinus headache, or motion sickness earlier in life. What's a common provoking habit of elderly persons with migraine? A common issue here is, and likely the most common reason, that elderly migraineurs see a headache doctor is overtreating their headaches and developing medication overuse headache. It's reported that 1/3 of elderly migraine patients are overtreating. What about patients with abdominal migraine? Abdominal migraine is mainly GI symptoms of nausea, vomiting, stomach cramping, anorexia, and centrally positioned pain around the belly button. There may also be mild headache, but GI symptoms are more prominent. Abdominal migraine starts between 11 and 20 years old, and in 70% of persons turns into plain old migraine headaches by age 20 years old. Girls outnumber involved boys by 3-1. However, for this population of children, migraine starts at a much younger age. Treatment options for patients with migraine that may end the headaches. And this is important because occasionally one of these issues, drugs, lifestyle, prevention drugs, will stop the headaches completely. So lifestyle issues for living with migraine. Attention to these lifestyle issues can significantly improve or sometimes stop the occurrence of migraine headaches. Caffeine is a double-edged sword. Most persons like to drink caffeine, and although it is an addictive drug, according to the Diagnostic and Statistical Manual of Mental Disorders, version 5, drinking caffeine can be a very pleasant experience for most people. The problem is that caffeine is a vasoconstrictor and can aggravate migraine or give medication-induced headache if too much is used. This issue is especially important to persons with migraine. The American Headache Society has stated that caffeine is the number one drug in America causing an increase in the intensity and frequency of migraine. Caffeine use is confusing because many persons know that caffeine may be used to treat headache, but they need to learn that if it's taken frequently more than 2 days a week, it can cause medication-induced headache, previously called rebound headache. As a neurologist and headache doctor, I know that many people with migraine do drink some caffeine and they get by with it and probably do okay, but it's the slow, sneaky, addictive quality of the drug that bothers me as a doctor, and I think bothers many migraine patients. And overall, I advise migraine patients to not drink caffeine. Diet issues. Avoid fasting or missing a meal. A small breakfast will suffice, but usually from mostly young women who fill the offices of neurologic headache doctors all over the world, the advice to eat breakfast meal will be met by a vacant look and denial many times. And I would say to them, did you know that the word breakfast means to break the fasting of sleep? If you did not eat without your knowing it, your pituitary gland will sense your low blood sugar and send out a hormonal signal that will cause vasodilatation of your cerebral arteries and the start of your hungry headache migraine. 3 meals a day is advised by all medically accepted weight loss programs, such as Jenny Craig and Weight Watchers program. But my experience is that most mothers will feed their children 3 meals a day, but not themselves. Exercise. The American Heart Association has recommended for adults that there's straight copy, and here it is. I'm going to copy it from the website and just say it to you now. So the recommendation for adults, it is get at least 150 minutes per week of moderate intensity aerobic activity or 75 minutes per week of vigorous aerobic activity or a combination of both, preferably spread throughout the week. And you should add in moderate to high-intensity muscle strengthening activities such as resistance or weights on at least 2 days per week. Spend less time sitting. Even light-intensity activity can offset some of the risks of being sedentary. Gain even more benefits by being active at least 300 minutes or 5 hours per week. Increase the amount and intensity gradually with time. The above recommendation is for general health, but did you know that one may improve migraine, anxiety, panic disorder, depression, tension headache, and sleep troubles with aerobic exercise? There are hundreds of scientific articles over the past 20 years proving that exercise works for headache therapy. Aerobic exercise is dance, aerobics, jogging, cycling, swimming, rowing, cross-country skiing, and stair-stepping. It is not walking, lifting weights alone, stretching, or playing most games like tennis or racquetball. If you're already exercising and still have bad headaches, consider increasing your exercise program. Exercise is something you could do for yourself to take control of your headaches, but it takes determination, time, and effort. Overweight can increase the frequency of migraine attacks. Some migraine patients will get a workout headache if they get hot. And if this happens for you, then you should try to work it out so you don't get hot. Exercise either in front of a fan or an air conditioning. You could also take 2 ibuprofen, etc., and a half of a trypsin drug before you work out, remembering to limit all painkillers and triptans to no more than 2 days a week. And if you still get a workout headache, then try swimming. Adequate sleep. Migraine patients often do not sleep well. 50% of migraine patients are depressed, or 40% have generalized anxiety disorder, which both have. Insomnia is one of the cardinal symptoms. Regulate your sleep. Set your sleep-wake cycle to rise and go to sleep at the same time every day, even through the weekend. Adults should sleep between 7 and 8 hours every night. Wake up at the same time on Saturday and Sunday morning as you do during the rest of the week. Migraine may be treated by sleep restriction. Avoid oversleeping Saturday morning or falling asleep for that seductive 2-hour nap on Sunday afternoon. Set an alarm for 15-20 minutes for a short, energy-restoring nap. If you never learned how to do a nap, then learn to do it. It can be done. There are stages of sleep, and most migraine patients only get into light stage of sleep at night and not deep sleep. Either too much sleep or not enough sleep can set off a migraine. Unwind at the end of the day. Listen to some soothing music, take a warm bath, read a favorite book. Hard exercise, big meals, caffeine, nicotine, and alcohol can interfere with sleep. Minimize distractions. Save your bedroom for sleep and intimate relations. Do not watch television or take work materials to bed. Close your bedroom door. Use a fan to muffle distracting noises. Be sure that none of your medications can interfere with sleep. Look them up, their side effects on the internet. See if that's what's making you not sleep well. Dealing with stress. Many patients I talk with are not having any stress. Talking with them is like, it's somebody else's problem, not mine. They either don't understand what stress is or are willing to discuss it with a regular non-psychiatric doctor. These are the stressful events in life. Change of environment, leaving home to go to school or start a new job, death, accident, or major illness of a parent, grandparent, sibling, close friend, spouse, or sweetheart, birth of a new child, loss of a job, starting a new job, financial stress, mortgages due, old bills, unexpected financial responsibilities. We all go through these types of things. They are the ebb and flow of our lives. Therefore, learn to talk over your daily life problems with your friends, family, preacher, priest, or rabbi. Develop a support system to sustain you in life built up of key people who are there for you when you need them. Plan time to relax and spend on hobbies or interests. Normal people have hobbies, which is something you do not do for fun. And it's not just for relaxation, but hobbies are creative and not goal-oriented or money-oriented. Children and family are not hobbies. Turn off a cell phone, computer, iPad, and get a life. Plan 3-day weekends several times a year rather than 1 to 2 hour holidays in August. Leave that depressing, stressful job or get counseling and try to change a personal relationship that is causing problems. Try to avoid deep breathing. Get family and personal counseling or learn CBT, cognitive behavioral therapy. Look up CBT on the internet, and you can learn it. You can see my Dr. Migraine article on depression, anxiety, and CBT also. In fact, this article is there. You want to avoid overtreatment with medication. Do not take too much caffeine, over-the-counter drugs, Trypsins, or painkillers for headache. In general, all migraine patients should limit all such drugs to no more than 2 days per week. The migraine process generates neurochemicals which are released in the brain and inflame the thalamus, the trigeminal nerve, and the cerebral arteries. These neurochemicals stay in the body 3 days, and once they inflame the brain, they are repeatedly released every time other painkillers like caffeine, Advil, Tylenol are consumed, starting a process of continuous headache. I once saw a man who told me he'd been taking 10 Excedrin migraine pills for over 50 years old. That's 10 times 65 milligrams equals 650 milligrams a day of caffeine. And he had a headache all that time, every day. And I convinced him to stop Excedrin, then his headaches cleared up. There's no data that opiate narcotics help migraine headaches. They just cause problems and should not be used for rescue treatment. The U.S. is now going through a change in the use of opiate narcotics and barbiturate drugs. Since they can cause people to die in their sleep, they are addictive and cause medication-abuse headache. Narcotics should be used never or only persons in severe pain and near the end of life for acute trauma or surgery, and only for a short period of time and then stopped. Death from opiate narcotics is a top problem now in America. Butalbital is the worst drug. It's found in Fiorinol, Fioricet, and Esjec, and it has been banned in every country in the world except Canada and the United States because it causes medication-abuse headache. The word narcotic comes from the Greek word that means sleep. In Texas, the number one reason for the state medical board to restrict physicians' concern is over their use of medications with opiate narcotics in it. And most licenses in Texas are restricted or revoked regarding this issue more than any other. All right, you want to avoid food triggers. People with migraine may have only individual foods that seem to set off their headaches, and the subject of food triggers is a very controversial, still poorly researched subject. But if certain foods seem to set them off, I advise patients to avoid them. And these are commonly alcohol, chocolate, aged cheese, MSG, and red wine. If you know certain foods are a problem, then don't eat them. I have an article on food-triggered migraine that's on my blog, drmigraine.com. Eat regular balanced meals, basing your diet primarily on fruits, vegetables, whole grains, lean protein, and healthy fats, and limiting foods that trigger an attack is a good way to prevent migraines and or headaches. Also, do not skip meals. Skipping meals just make you hungry, which can trigger migraines, I've already discussed. Dr. Kelman had released a list of migraine triggers. He gave a percentage here. So the migraine triggers are, what's the most common thing? Stress, 79%. Hormones in women, 65%. Not eating, 57%. Way at the bottom is alcohol is 37%, smoking 35%, and things like that. So the most common thing that sets off migraine is stress. You could also check barometric pressure changes that aggravate migraine. There are scientific articles verifying migraine attacks with changes in barometric pressure. I think this has been established as a reason for the attacks, and how pressure affects the brain really, as far as I know, is not understood, but it does. Modern cell phones or computers can report recurrent barometric pressure changes for where you live. If you get attacks with barometric pressure changes, then keep a pressure diary. Watch out for a migraine that may occur then. Migraineurs may treat before the headaches come on with triptan or some other drug. What should you do when a migraine does start? Treat early with a triptan when migraine starts. Find a cool, dark, quiet place. Get off TV or your cell phone. Rest your eyes. Relax. Deep breathing from your diaphragm can help you relax. Focus on inhaling and exhaling slowly. Think positively. Learn how to deal with a migraine interrupting your day. Learn Cbt skills, as I mentioned before. It's not the end of the world as typical Cbt language, since migraine patients tend to think negatively at the time the headaches come on. It'd be helpful to keep a migraine diary, and there are a number of free cell phone apps for migraine available. I have a blog post on the subject of this. Patients can plot issues such as menstruation, weather change, stress, missed meals, occurrence at night, or wake-up headache. Study carefully any trigger that seems important and recurrent. Living with migraines is a daily challenge, but making healthy lifestyle choices can help. Ask your friends and loved ones for support. Pray to God to help you with your life and your health. Okay, what about triptans for acute migraine treatment? I tell patients that triptans have headache-free data for migraine treatment in 70 to 80% of patients. Patients may be headache-free by 2 hours if they treat with a triptan at the onset of their migraine. Dihydroergotamine, DHE, has no headache-free data, but Migranol nasal spray, which also has DHE, may provide relief in 61% of migraine patients in 2 hours if used at onset. And many patients with migraine use over-the-counter drugs such as supplements, caffeine, NSAIDs like Aleve and Advil, or doctor prescribed narcotics like hydrocodone or butalbital. And these drugs provide a variable clinical response. The other problem is that insurance coverage for triptan is spotty, and some patients do not respond or have limiting medical issues, so they cannot take triptans. Like if you've had previous heart attack or stroke or hypertension out of control, you can't use triptans. But triptans for migraine treatment are the first choice for migraine treatment. They're recommended by migraine headache authorities. They're all generic and reasonably priced now with insurance. There are some new migraine acute therapy drugs available that came out in 2020, and they are Nurtec, Ubrelvy, and Rayvow. So these are all expensive, name brand, and they don't really work as well as triptans do, but they may be helpful for that 10 to 20% of patients who don't respond well or cannot take a triptan. What about preventive drugs for migraine? The idea here again is that sometimes you put a patient with a preventive drug and the migraine just disappears and gets better. Not that often, but every now and then that'll happen. So the American Academy of Neurology has advice for migraine prevention treatment. They have level A drugs that have been established are effective, and those are divalproxazine, topiramate, frovatriptan, botulinum toxin, Botox, beta blockers, metoprolol, and propranolol and timolol. So sometimes that'll help. Currently, we're in a world where we now have very effective CGRP drugs, which are much better than the previous older drugs I just mentioned. And these CGRP drugs, and there are 4 of them, can reduce migraine 50% in 50% of patients, or 75% of 25 patients, and by 100% in 25% of patients. That is, rarely, but sometimes a patient will be taking one of these drugs and they don't have headaches at all. These are amazing results for the CGRP drugs, which have significantly changed the experience of having migraine for many persons. All of these drugs inhibit signaling by the calcitonin gene-related peptide, and in general, they all perform about the same. Okay, some comments about the usual age of onset of a migraine. Migraine usually starts at 25 to 30 years old for men and women, with peak occurrence between ages of 30 to 39. And for some, migraine starts in the late teens, early 20s. Women have migraine more frequently than men at a rate of 3 to 1, starting as teenagers, and this continues all through their lives. 85% of adults with migraine are women, and hormones are thought to be one of the main contributing factors to the increased occurrence of migraine in women. Occasional patients start with regular migraine during childhood at a younger age of 5 or 6 years old. Pretty rare, but migraine at onset during childhood may not always have a genetic or familial cause or origin. Some persons develop migraine as adults, kind of unusual and weird, but particularly women around perimenopause, which period of time before menopause will develop headaches then. And 90% of patients with migraine will have their first attack before 40 years of old. So I hope it's a helpful discussion of migraine and aging, how long you have it and how long you're going to have it till it stops. Please click on like down there. Stay with me and listen to you again on the next talk. Thanks very much. See you later.